blessed. I'm very blessed, and thank you, Sister D. Thank all the listeners from WFLT. We have a wonderful, wonderful broadcast for you this morning. We want to make sure that we want to thank our Lord and Savior, and we have a great show for you with a lot of information that we all need to have, especially going through this very difficult time. But we want to definitely lift all those in prayer that need prayer right now. All those who have lost loved ones over this past week. We want to make sure we honor and recognize them. And we want to ask Pastor Hawkins of Prince of Peace Church to guide us in prayer this morning. Pastor Hawkins?
Yes, sir. Eternal God, we thank you for this opportunity to pray and for blessing us with another day. We pray for those who's been affected by virus, and we pray that your healing be upon those and that you continue to just give wisdom and knowledge to the powers to be, and that the decisions that be made to work for the people. We pray for our mayor, for all of our elected officials for the city of Flint, that continue to guide them and keep them. And thank you for this show for allowing them to be informative, to be a help to the community at large. We declare this type of victory in Jesus' name. Amen.
Amen. Amen. And thank you for that. This morning we have Pastor Jeffrey Hawkins of Prince of Peace Church, Dr. Deborah Furholden, Dr. Lawrence Reynolds, and Minister Vic. All today to talk about some very serious issues that we have facing us in America, also in the state of Michigan, and also here in the city of Flint. Michigan has been the hardest hit state in our country, one of the hardest hit states in our country economically as it relates to the pandemic. Michigan is only surpassed as far as economic challenges in our country by the state of Hawaii. Michigan has been hit with a lot of economic issues, also a lot of casualties of this pandemic. To date, we have 67,000 confirmed cases of affected residents inside the state of Michigan. Out of that 67,000, those cases, 30% of those cases are African Americans. 39% of the deaths in the state of Michigan have been African American, and in the state of Michigan only represent 14% of our residents are African American. So those numbers are very, very devastating, especially to communities of color. And I want to give a big shout out and thank you to State Representative Cynthia Neely, who had a great testing with the National Guard, and also Governor Gretchen Whitmer. A lot of residents got tested, and also a big thank you to Shiloh Missionary Baptist Church, where Daniel Moore is the pastor, for allowing that testing to happen there. The only way to beat back this virus is to be able to do the things that's necessary that's recommended by the health professionals and also our scientists. Washing your hands, maintain social distancing, and also masking up. With that, also, we have to be tested. And I'm going to lean to Dr. Furholden this morning because Dr. Furholden may have an announcement for us this morning, also about the cautionary measures that we need to take as people against this deadly virus, COVID-19. Dr. Furholden, how are you this morning?
Good morning, Mandy. Thanks for having me. These conversations become more and more relevant as we continue to progress through this pandemic. Thank you for, just giving us what the data tell us. I think that's so important. I've been really surprised to hear how many people think this isn't real, how many young people especially believe that this pandemic is a hype or, and it's heartbreaking because we've now seen so many people that we know who've personally been impacted. That I always tell people death is awful, because there's no coming back from that. But a lot of people have gotten sick, and a lot of people are living with now what we don't know, but could potentially be long-term consequences of having been infected by this virus. So I just think these conversations now are more important and more relevant than ever. I did want to highlight a couple of things, a little bit of information that we got recently from the health department. As you know, cases are on the rise again all over the country and in Michigan. I think we did a very thoughtful job of looking at what reopening would look like. The governor had this phased plan. I think there was good sort of public health and protection of our community at mind with that phased reopening plan. I think Flint did an even better job of making sure that we were opening at a pace and in a way that would protect and preserve the health of our citizens. And lo and behold, what we've seen is what we've seen in other places. As you increase the opportunities for people to come in contact with one another, what you do is also potentially have an increase in the spread of the virus. So in fact, cases are on the rise in Genesee County, and they are on the rise in Flint. To that end, we're now seeing a little bit of a dialing back of the reopening so that we can do it in a way that doesn't unnecessarily put people in harm's way. The statistic that I found most compelling is that the health department has been looking at new cases of coronavirus, not just by race, but also by age. And what we've seen in the past week is an 18% increase in coronavirus cases among the under 50 population, so the 18 to 50-year-old population. So I think this is like sounding the alarm, like people now more than ever, it's important that people practice the protocol. Because even if you are protected, we have a lot of young people. You know, the younger you are, the healthier you are, the more likely it is that you could be walking around with the virus, able to spread the virus to others, but you could be asymptomatic. So what you run the risk of is you seem okay, you feel okay, but you've moved about, you know you've been out, you participated in events, you participated in gatherings, you've contracted the virus, but you yourself are asymptomatic, but you take it home and give it to your elderly grandparent, or you take it home and give it to your uncle who's immunocompromised, or you take it home and give it to grandma who's already struggling with hypertension and diabetes. So now more than ever, it's important that we honor the protocols.
Right. And we want to make sure post 4th of July holiday where people gathered and people are now becoming desensitized to the warnings of the medical professionals. The virus is now having an uptick, not only in the state of Michigan or in Genesee County, but all across our country. And what we cannot do is be so irresponsible to where we know that we have a deadly virus amongst us, that we will transmit that virus with little regard. Any person in elected capacity or anybody attempting to say that they are leaders of a community or would like to be, that's not warning you to this very, very deadly virus is not responsible. We have to continue to push forward and make sure people are armed with the best information every single day. And that's what we have done here in the city of Flint. And we have saved lives through some of the proactive engagements that we have made. And we will continue to do so unapologetically about making sure lives are preserved here. But make sure we are not distracted those that would tell you something different or not warn you about what is going on amongst us. Those will be more critics of what is happening amongst us versus giving you the information that's necessary to safeguard our lives and those of our family. We are seeing a great deal in loss of life. As Dr. Verholden said, we have seen a new segment of this infection setting out in young people. And young people have a duty to be responsible as it relates to making sure that you do not contract this deadly virus and you do not transmit this deadly virus. And so with that, you know, the person who we have steering our helm on the health side of the city of Flint, a person who we've hired here in the city of Flint to be our lead health navigator is Dr. Lawrence Reynolds, and he's been doing a fantastic job. And thank you, Dr. Reynolds, for all the work that you've been doing and the information that you've been providing this administration to help preserve life in this community. What do you have to say about what Dr. Verholden has said, and what more warnings can you provide for residents out there in the community?
Yes, thank you, Mayor. First of all, folks should never lose sight of the fact that we were the first city to stop disconnecting people from their water and to start reconnecting people to their water. And the governor has now extended water reconnections and stopped disconnections until December 31st. Washing your hands and your eating utensils and your clothing is the first line of defense for personal hygiene. So it's obvious to everybody, but previous administrations have ignored that. The other issue is wearing a mask. Dr. Verholden covered that completely. The bottom line is we are still responsible for each other. Then there are things we can do. Stop smoking. Stop vaping. Cut out or cut down your alcohol. Those are all things that weaken your immune system. And then avoid crowds. Now, I can give you the numbers where it says for an indoor gathering, it shouldn't be more than 50 people. Well, the other conditions are that space should be well ventilated. And your air conditioning system, if you're in a public space, like a church or a meeting hall or even a bar, you have to make sure that the air is exchanged so you're not recirculating the same old air over and over again with an inadequate air filter. And I want to thank the places of worship who have held the line and said, we are not going to reopen until we get this coronavirus under control, that we clean and check our facility, that we have plans for our facility so that people who come to worship don't gamble with their health. So I thank those pastors.
Right.
Now let's get back to immunization. If you are not up to date, get up to date. Call your physician, your schools. They have access to immunization records through the Michigan Immunization Registry. Get up to date for diphtheria, pertussis, measles, mumps, chickenpox, pneumonia. If you are up to date now, that's great. And get ready to get your flu immunization in August, because flu season is coming and it would be hard to differentiate the flu from the coronavirus.
With that, Dr. Reynolds, saying that, you said a great deal of things that is brings about more questions for me, and also I'm sure with the listening community. But you said the flu virus resembles much the same symptoms as the COVID-19 virus, and so should people be tested for COVID-19 prior to getting a flu shot moving forward?
These are the reasons to get tested for corona. If you work outside the home, if you're taking care of someone who's sick, if you have any symptoms, yes, you must definitely be tested. We need to expand testing so we have a snapshot of what's going on today, and we can follow trends and developments like increases in the number of cases by certain age groups, races, and locations, and occupations. And sometimes there are those who face the public in nursing homes or other specific occupations. They may need to be tested on a regular basis, like depending on that work situation. And you should check with your employer to find out what applies specifically to you.
Right. And we want to make sure we continue to provide those level of testing sites. And like I said earlier, we want to thank State Representative Cynthia Neely, Governor Gretchen Whitmer, the National Guard, Dr. Bobby Makumala, who all came and lent their time and talent to be able to have a mass testing. No appointment was needed, no dollars required. And so get tested. The only way that we can battle back against this COVID virus is to provide people with a level of testing, and that's what good leadership does. Also, with the faith-based community, we moved to Pastor Hawkins and also Minister Vic. Pastor Hawkins, over at your church, Prince of Peace, are you guys engaging in worship service? And if so, how are you doing? How are you doing it?
Thank you, Mayor. We're currently engaged in only on Sundays in outdoor worship, which we're still, members are still sitting in their vehicles. And then, of course, still going online. We're not doing any indoor services at all, or our Bible studies online. Again, we're trying to not only keep everyone safe, but I think it's been noted, keeping up with the science, the data, just to make sure that, and of course with the governor's mandate equal, just to make sure that we're keeping everybody safe and we're doing our part. And I know that so many people want to get back to, a form of worshiping on the inside. For me, now this is not the time for that.
Right. And moving through, and we're not only are we facing this pandemic, but we have a time of civil unrest with the George Floyd incident, with law enforcement engaging, and especially this virus who was attacking moreover communities of color. Minister Vic, professor, you teach at a couple of colleges. But moreover, as we talk about this pandemic and the other civil unrest, and we have a collision in crisis here inside the city of Flint. And so tell me, what recommendations would you may have from the spiritual area as well as the logistical area from a college professor's perspective?
Yeah, thanks, Mayor. Certainly, we have to remain vigilant, and we must continue to follow the advice of like the doctors we have online today, Dr. Furhold and Dr. Reynolds and so forth, in terms of tapping into the information that they're providing us with and that the medical community is providing us with. I think that's very, very important that we embrace this information and continue to practice social distancing, washing our hands and things of that nature. But as far as going into the community, certainly we need to connect with our young people, because as I move around the community and I go to other communities, I see people playing basketball. I see people being physical in that regard, not wearing masks, things of that nature. I see people having parties. Down the street from my parents' house the other night, I saw a group of people who weren't practicing social distancing. They were having a party, having a barbecue, and so forth. There were literally 30 persons, right, in this family's yard doing these different things. So I think that we need to, number one, connect with the young people in our community. Now, I don't want to paint all young persons with a broad brush, because I've seen some gray-haired folk doing some things that are questionable as well. So I think that we certainly need to be vigilant, and we need to engage one another. And when we see somebody that is doing things that's not wise, we must pull their coattail.
Right. You know, what I found is as far as administrative offices and also guiding this community, we've made some very difficult decisions, but we made decisions to make sure to preserve life in this community. And we have done so with great results of preserving life, because proactively, as we look at the things that we've done and what other communities have not done, we preserve lives here inside the city of Flint. But the enforcement level has been very difficult in some aspects of it, because of the things and those individuals that will try to cause confusion where we're trying to guide our way through this very difficult maze of preserving life. As Dr. Reynolds has said, with my administration, we have not disconnected one user during my term of office for the lack of payment of water. We have reconnected more than 580 people to the water system, trying to make sure we balance that with, making sure we make our utility payments to the people who provide us with the service of water. We have done so because good residents, good citizens continue to pay on their water bill. And also we've had a utility payment assistance program where we match residents dollar for dollar. We're going to try to revisit that here in a very, very near future, whereby where a resident pays $1, we pay $1 up to $75. But we do need the support of our co-equal branch of government, which is our city council. We will be presenting them with a resolution to do so, to be able to assist those residents who have been disconnected from the workforce, who are having some economic challenges, that we want to make sure that we provide them with the assistance that's necessary to help them pay their utility bill. And so that will be coming very, very soon. So I would ask all concerned citizens and all people who may have a need or know of someone that have a need that to be paying attention, because those dollars go very fast once we make them available. And we want to make those dollars available not for just the general population, but moreover the population that's in need. And we have been doing so with a social mind here. As we move forward, talking about the governor's executive order, starting on Monday. Monday, it will be an executive order by the state of Michigan for people to wear masks. If you are dining inside, you have to wear a mask. It will be a penalty, a financial penalty and a misdemeanor crime if you do not follow the mandate of the executive order. Now, I'm asking people, and the state representative has been talking about masking up for a very, very long time. And the state of Michigan now is following those type of recommendations from good leadership, because we know to limit the spread of the virus, people have to mask up. Now, the city of Flint will be providing masks for restaurants, businesses. If you need help with that, please call 410-2020, 410-2020, and we'll give you these disposable masks that has been donated generously by a philanthropic partner to the city of Flint. And so we want to make sure that even though through a mandate from the governor's office, that you still have the resources to provide a level of safety for your customers, your patrons, and also your family and friends. And so, Dr. Verhulden, talk about a little bit about what we've seen across our country and also inside the state of Michigan, where we saw one restaurant they've been set a site of a super spread for more than 100 and so people has been connected to this particular restaurant because of the lack of whatever reason, people not wearing masks or observing the best practices. But Dr. Verhulden, can you speak to that?
Yeah, and so, we talked a bit about super spread, and I asked people to think about that in terms of people, places, and things. And Dr. Reynolds, really brought the point home. These large gatherings become sites of super spread, and then we have places that become sites of super spread, and we have people who become super spread. And I think what we saw in East Lansing was a combination of all of those things coming together. You've got a lot of young people who feel as if they're invincible. People who got antsy and decided they wanted to just get back out and re-engage. We had a business that wasn't being responsible about honoring the protocols and making sure that they could honor physical and social distancing within their establishment. And then you just got that good old-fashioned people that want to get together and party and have a good time. All of those things come together and create a perfect storm. So what we're now really beginning to understand is those people that were there, who did they then subsequently come in contact with? This is a real sad part about, dealing with such a communicable disease the way that we are, is that you could be doing the right thing. You could be honoring the protocols. You could be masked up. You could, basically shelter in place and go out only when needed and practice all the protocols. And all it takes is for you to come in close contact with somebody who is not doing that same thing. So I think what the governor has put in place now, requiring people to mask up indoors, is important. It's the kind of policy that we need everywhere. What I am hopeful about, and I know we'll do the work in Flint and Genesee County to make sure that this does not become a new tool to target Black and brown people, right? Because I think we also have to do a much better job at reassuring people this is real. This is what it's going to take to protect you. And these executive orders and the things that we're putting in place are to protect you and also to protect others. My biggest concern about this, the enforcement of this, and I live just a few blocks from that Family Dollar where that security guard was shot for simply doing his job and telling a patient she wanted to get her adult daughter in, and in fact the adult daughter had to have on a mask, and that man was subsequently shot and killed, is that I think about the woman or the man that works at Meijer who signed up to be a greeter, to greet people as they come in, and I think about the valid fear that people must have around trying to enforce that, because I have seen some very ignorant and irate and aggressive people who just refuse to honor these protocols. So I really hope that we can be thoughtful about how to not only, have this order be enacted, but have it be enforced and have people and businesses have the tools that they need to be able to enforce that and maintain their safety.
Right. And also, we want to make sure, because we have to push back against the irresponsible individuals and those people that live by anarchy and they're fueled by that and that type of malice. But moreover, we have to try to make sure that as responsible individuals, that everyone on this line has been given the task of trying to make sure that people preserve life. And also the governor is doing a very, very good job of trying to do these things. But I know the state representative has reached out to the young population where we have a large area of growth in the contamination of this virus, to have a cool mask contest. And so what the state representative Cynthia Neely is doing now is offering cash awards for a cool mask contest. I know the city of Flint has used Fabrics of Faith to design masks for us to be a little bit more cooler than the disposable masks with our names or logo. Fabrics of Faith has been doing a fantastic job, but also State Representative Cynthia Neely has offered a contest. If you post your photo with your cool mask, judges will take a look at it, and then they will give prizes from 1 to 3 for each high school, graduating high school senior, for a cool mask and awarding those individuals with their cool mask. And so all you have to do is go to State Representative Cynthia Neely's webpage, post a photo of you wearing your cool mask, and you can win a cash prize for posting your photo and having a cool mask. And if you need help finding a designer, or if you don't design your own, Fabrics of Faith has been doing the mask for me personally and others. And I think Pastor Hawkins may have a phone number for Fabrics of Faith. I don't have that number readily available in front of me. Pastor Hawkins, do you have a number?
Yes, sir. They can call 810-210-5045. Again, it's 810-210-5045.
And that just says that if we have a mandate to wear a mask, you might as well have what they call your own swag with your mask. And so I know Minister Vic is trying to get a cool mask right now, but I didn't say senior citizen, Minister Vic. I said seniors from high school can only enter that contest. And so
Right.
that eliminates you and Dr. Reynolds.
Wait a minute now, man.
Okay, I'm just saying, but we have to continue to try to preserve life in the best possible fashion, having a good time, and making sure that we are our principles of peace as we do so, and we can get through this together. But we have to maintain our faith, our focus on the positive things, and moving a community forward, and not be disrupted by the distractors that will cause us harm and loss of life. And so, Dr. Reynolds, we have a couple more minutes on our broadcast here, but go ahead. And I love the way that you enumerate the practices in which the medical profession has said to limit the spread of this virus, and we are so very serious about this. But go ahead, Dr. Reynolds, and tell people how they can limit the spread of this particular virus.
Wash your hands. Wear your mask when you go outside. And I would add, especially for senior citizens, avoid unnecessary trips. And for all of us to avoid crowds, especially avoid crowds in an enclosed place, but also to avoid crowds in an open space. And remember, wash your hands when you're done with an activity. And to the young folks, remember, if you have a young lady or a young man that you like, if you have a niece, nephew, or a little brother or sister that you like, you're doing this for them. So it's not just for the old folks. And if you have old folks you love, thank God, and remember, make a plan before you engage in an activity. What you're going to do when you arrive, what are you going to do when you depart, and make a decision. This is not a place for me to remain. Stop smoking, stop vaping, reduce your alcohol intake, and get your immunizations.
And stay focused on the positive out here. We need to gravitate toward the positive and the things that's going to help us preserve our community and our lives. Make sure you observe the mandate from the state government by wearing your mask. Enforcement will start on Monday of this week when the executive order goes into place. If you need help with getting a mask, 410-2020, the City of Flint, 410-2020, or go to our City of Flint webpage. Mask up. Be a part of that great solution to help us through this very difficult time. State Representative Cynthia Neely and seniors and young people, go to the webpage, present your mask and your swag, and then you'll be entered into a contest to be able to say that we masked up with swag and that we can win a cash prize. So do the positive things out here, move forward, keep God first, and think about each other. As we close out on our broadcast, radio broadcast, we will stand by for the Facebook burst. Thank you guys, and God bless. I love you, Mom. I love you. Let's all mask up. Okay, guys, we'll be standing by for our Facebook burst program. I know, Minister Vic, that you have to leave.
Yes, sir. You guys have a good day.
All right. Thank you, Minister Vic. Continue to be encouraged out there and continue to gravitate toward the positive.
Absolutely. Absolutely.
All right.
Thank you much.
Thank you. All right, guys, we're getting ready to begin our Facebook burst program once again. I want to thank Dr. Furholden, Dr. Lawrence Reynolds, and Pastor Jeffrey Hawkins of Prince of Peace Church, for joining us for the Facebook Burst program, providing us with some good information about what is going on and what's happening inside the state of Michigan. In our earlier radio broadcast, I talked about the number of 67,000 individuals inside the state of Michigan has been contracted the virus COVID-19. My numbers were a little bit off because I didn't add today's number. It's very concerning because once we look at today's number, it's 68,295 people. That is 1,000 more confirmed cases of COVID-19 contractions inside the state of Michigan than yesterday. A 1,000 case jump in one day. And so we have a very concerning issue amongst us. And so now that we have done all that we have done previously, we don't want that to go to waste. $6 billion, that's with a B, $6 billion of economic hardship has been hit Michigan through this COVID virus. Michigan is the second hardest hit state in America, the second. Hawaii's only the first. Michigan is the second. So we have a lot of work to do. But in the city of Flint, inside of Genesee County, we have been proactively engaging and protecting ourselves and our residents. We have to also be mindful of the way that we engage this process. We have to engage this process with a positive thinking, knowing that we can come out on the other side, not with a defeatist type of thinking or a negative perception of what we need to be doing every single day to preserve life in this community. We will not, and we have not, through this administration, we have not disconnected one user inside the city of Flint for lack of payment for their water. We have only reconnected users to the tune of about maybe 580 people. And so we're doing so with in mind that we have to provide people with the resources that's necessary to be able to protect themselves from this COVID-19 virus. Also, the city of Flint has engaged in being distributors of masks for businesses and some families alike that cannot get their masks. Also, there's a company, Fabrics of Faith, that's been designing masks and other places to design a customized mask for you. But also, we want to make sure that we observe the best practices. We have Dr. Deborah Furholden on the line with us this morning. And Dr. Furholden, I want you to talk a little bit about what's going on throughout our country and what we should be doing here inside the city of Flint.
Yeah, so we've seen the increase in cases, mostly associated with people re-engaging, and I would say a bit prematurely. And I do recognize and appreciate that there's a lot of mixed information that's out. And so I think these kinds of formats and multiple ways to get good messaging to people is critical. And one of the things that I would love to touch on is the importance of testing. And having been in Maryland, having been exposed myself personally, self-disclosed, I'm expressing symptoms of COVID, so I'm on self-quarantine right now because I'm committed that if I have in fact been exposed, that I not expose others. And I will tell you, getting tested here has been quite difficult. There are a lot of restrictions around testing related to whether or not you're a resident, etc. And it gave me such a deep appreciation for how easy that is in Michigan. My children all returned to Michigan, and they were able to get tested the same day. All of my children returned to Flint and were able to get tested the same day. We had this amazing partnership between the governor and Representative Neely and the health department to make sure that residents in Flint have access to testing. And I do appreciate and acknowledge that our first round of free testing offered through the National Guard was a bit congested, and people had to wait, and we had a demand, and some people had to get turned away, if you will, with kind of a rain check for come back next week and you'll be first in line. I want to make sure that residents now understand, you know, we're innovating and we're learning to fly the plane in flight. I say it's even more than that. I feel like we're changing the tire while the car is moving. And that testing has now been so streamlined that in fact, the amount of testing that's available exceeds the demand and the people showing up for testing. So I want to make sure that people know, you know, Flint is out in front. Genesee County is out in front. Michigan is out in front. And so I really encourage people to utilize and access the testing. And the testing isn't just for people who are symptomatic. If you know that you've attended a large event, if you know that you've been moving out and about a lot, you should get tested, one, to protect yourself and also to protect others. So I really want to underscore how important testing is and the fact that we very much streamlined the testing process. And right now, it is one of the most powerful tools that we have to identify cases, to allow people to self-quarantine and protect themselves and their loved ones from contracting this virus. Because I do not think people are prepared. I think people have a myth that this virus is just going to affect the elderly or people who are already sick, and that's simply not the case. And even if that were the case, why would you want to be the person who gave this virus to your loved ones? I have a very good friend here in Baltimore who was walking around asymptomatic, went to visit his grandmother, gave his grandmother COVID, and she died 8 days later. He now has to live with the physical and spiritual liability of knowing that he was the one who exposed his grandmother. So I really encourage people to get tested and to practice the protocols.
And, and when we talk about that, yesterday and the day before of this week, free COVID testing was at Shiloh Missionary Baptist Church under the leadership of Pastor Daniel Moore, in partnership with State Representative Cynthia Neely and also Governor Whitmer and the National Guard. And it was streamlined. It was pretty easy to come up and get tested. More than 500 people were tested over the last 2 days, and we're going to have more testing next week as we move forward. But I want Dr. Reynolds, I want you to talk about the testing and retesting, because I took the test once again yesterday. I took a test again yesterday. That was my second time being tested. And so can we explain to people that just because you take the test once, well, what that looks like and what that means, because we need to be multiple tested? Can you just talk to our listeners about that?
Yes, I'll talk about a special situation. Say you get tested today, and 2 to 3 days later, you come down with symptoms, and you tell yourself, well, I tested negative 2 or 3 days ago, I'm good. No, you may need to get tested again within 2 days because your test may have converted. The test only picks up an active, full-blown infection, and you can be symptomatic or asymptomatic and still have an active, full-blown infection. Then we have special occupations and special situations. People who work in nursing homes, in hospitals, first responders, people who live in group homes and shelters. You may need to be tested weekly. Did you hear me? Weekly. And we need the capacity to do that. If you're working in a service industry where you have free contact with the public, and you're in an area like Region 1 in the governor's recovery plan, and we're still medium risk at this point, you need to be tested, and it may be as frequent as every 2 weeks. So I give you these examples, but you must check with your employer or the health department or your physician to get the exact details based on your occupation and what you do. So it's incumbent on employers also to provide adequate protection. That includes masks, hand sanitizer, facilities to wash your hands, distancing. These things are required. And if distancing can't be maintained, you need a barrier. And why am I going into such detail? Because basically, people of color and people who aren't making $100,000 a year, they work in jobs where contact with the public is required every day. Care of people who are ill is required every day, and they have to show up at work. So there's a whole category of essential workers who are invisible to the news stations and TV, but these folks keep our community going.
Dr. Reynolds, when we talk about the testing and retesting, and that's why it's important for us to reiterate that so heavily, and because we have people, they have cabin fever, and we know we have a great, large faith-based community inside the city of Flint. We have more than 400 churches, and sometimes pastors and the parishioners are really thirsting to get back into the fellowship mode. And so, Pastor Hawkins, I reach out to you because in some aspects, I don't see a lot of the faith community speaking to this. They're talking to their own parishioners through Facebook and other mediums, but the broad education about what is going on and to be tested, I don't see a lot of movement there. And is there a particular way that we can remedy that so we can use the faith-based community and the communication network to be able to educate people in a broader fashion? Because really, I see that churches are really trying to modify to really get back inside of the building. I receive lots of calls. Even we're providing masks for churches that say they want to reactivate and reopen their doors. But how can we slow the pace of this? Because we don't want to lose lives. Do you have any recommendation? I know you probably don't have the answer in total, but do you have recommendations on how we can address the faith-based community to alarm them even further about the measurements or the repercussions of opening too soon?
You know, Mayor, one of the things that when we say that even the faith-based community, because if we're still part of the community, so I would say we must take an active approach on being responsible. I was just thinking, I have a 3-week-old granddaughter, and then I have a 78-year-old mother. When I think about the two, I'm thinking about doing my very best to keep both of them safe and healthy. But that's the same approach. If I would want to do that, then I'll make sure I do it for others, and I would want others to do it for me. The church must take that type of initiative to say we want to keep everyone healthy and safe, from our youngest child to our oldest senior. We want to keep everyone safe. We want to keep them healthy. As I stated before, now is not the time to reopen and to gather, and particularly when we start looking at enclosed spaces, because obviously we've seen time and time again where these enclosed spaces has been a breeding ground, unfortunately, for this virus. And the last thing I would want on my conscience, on my heart, is to know that I've gathered people together in the church and then there was an outbreak. I would not want that, even though we're having service outside. We're certainly doing social distancing because everybody's in their cars for the most part. And we won't do choirs. We won't do any of those things that would put anybody in harm's way. So we must really, really be conscious and just know that we don't want to put anybody in harm's way. And then to mention the piece about cleaning, sanitizing, disinfecting, that's something that is really crucial when churches do gather. They must know that these places have to be completely sanitized and disinfected. And it's just much at risk. So I encourage all the pastors, all the clergy. I encourage all the churches. Let's not jump ahead of this thing. We'll do outdoor services and be really creative in how we reach people. But now is not the time for churches to begin to engage in that type of worship and active services on the inside. And it would be so unfortunate if that happened. And now parishioners in droves have become sick and ill because of this virus.
But, I tell you, it's very troublesome, because we have here at the city of Flint, we have so many different things to balance. We're at the intersection of crisis right now. We have a water crisis still ongoing. We had some bad actors and some bad intent, I believe, moving forward. We're trying to clean that up, and that's at one point of that intersection. Also, now we have the pandemic, COVID-19, and as it engages communities of color with the aggression that's seen more in communities of color than anywhere else, that is a point of an intersection. And also now we have the civil unrest. And then we have, practice fault finders and many engagements trying to distract us from what's most important. And we understand that we have, we as a priority list that we have in my family is God, faith, and family and community. We move forth in those things as I enumerated them. But protecting and preserving life in this community is very important to us. And we're focused on just those things. And so now we have the engagement with executive orders and then the element of trying to enforce these things. And it's become a little bit of a challenge to try to navigate that intersection. So I ask all listeners to this Facebook broadcast to gravitate toward the positive, to push back the negative, to rebuke it in all its aspects, because right now we're in a fight for our very, very important lives that we live and the lives of our families. So if you have a self-love of yourself or your family or your community, we have a duty to align our thinking around the positive things, around the engaging things that's going to be moving our communities forward, and to rebuke all negative aspects of what can distract us from preserving lives. And that is why we have went through a great expense and are undergoing to make sure that residents have the ability to wash their hands and bathe, reconnecting users, never disconnecting users to the water system. We also have the ability to be able to get the best medical minds and a scientist with Dr. Furholden and Dr. Reynolds to be able to consult with us, to be able to take their advice and their leadership to be able to help preserve life in this community. And also our faith-based partners, Pastor Jeffrey Hawkins and Daniel Moore, and also Pastor George Wilkinson, Pettigrew, Pastor Michael Pettigrew, and Herbert Miller and others that have been lending themselves to our efforts with Pastor Patrick Sanders. And I know I'm leaving a few out, but those of us of like thinking, we have united with one agenda item, and that's to preserve lives in this community. Also for the least amongst us, when we talk about low to moderate income areas, we have to make sure that we provide them some resources. And that's why we have the utility payment assistance program inside the city of Flint, in which now we're trying to re-engage to be able to help people pay on their utility bill dollar for dollar up to $75. But I also need my co-equal branch of governance, and that is a city council. And so we have partnered with Vice President Maurice Davis and also others on council of like thinking. And I don't want to start naming the names because they will chastise me if I forget any of them. So I'm going to say them in total. We need your partnership. We need your leadership. We need your positive engagement in this process to move our communities forward. Those who've been using our communities for garbage cans, we need to be very upset, equally upset at the people who are dumping and using our community as a garbage can, as you would be if I came into your living room and dumped a bag of garbage in your living room. I think you would be very upset. So we have to start viewing our common public places as our living room. It is our community. Our children have they deserve the right to be able to go to and from places in their community, absence all the blight that they see. And so as we work toward our goals, we need everybody on board. And so with that, I want to speak to also Dr. Furholden, which is a well-traveled individual. Also, she is a Northern Viking, and I champion the Big Red everywhere we go. I love all of our schools, but Big Red has a special affection in my heart because I'm an alumnus from there. And Dr. Furholden is an alumnus also from Big Red, and so, but she's traveled to Baltimore, and she's held her doctorate degree since the very young age of 24, 25 years old, and you can correct me on that. And so she's lent her expertise back to the community in which she grew, and now we need to take her advice. Dr. Furholden.
I'll say, and I'm not the only one, there's a movement afoot in Flint, and we've got some amazing young leaders in Flint. Like some amazing people who went out, took what they got as a foundation in Flint, in our public school system, went and built upon that foundation, and then chose to bring that expertise and that knowledge and that passion and that will for change back to our own community. So I stand proudly with a whole bold group of people. Not all of them have the great distinction of being a Northern Viking, but there are many great leaders who've chosen to bring their gifts and talents back to Flint. And so, yeah, I tell people this is not one of those things. There's no, there's no reward in this for me besides just standing in my own calling. I do what I do because this is what makes sense to me. I've always been somebody who wanted to do something that would make a difference. And health and help at the level of the public and at the level of the population is where I found that expression. When we first started in this pandemic in March, I reached out to several people in my life. I'm very close with Miss Pamela Lovin, who's a Flint native and has been a real leader in Flint. And I wanted to explain to her with everything I had in me how important it would be for her to protect herself. I've had many, many individual level conversations with people, and I realized that would be insufficient. What we need is a community-wide strategy to get the word out and to let people know that what we're dealing with, not only is it real, but it's also manageable. This is something that we can get our hands around. And I'm telling you, when we talk about what the city of Flint has done to save lives, that's not trivial. Keeping people's water connected and reconnecting people has saved lives. The community-wide testing that we have available to people with no barriers, no limitations, no insurance requirements, no primary care prescription, requirement is critical, and it has saved lives. So I think if we can strike that balance of continuing to do the good, systematic, community level work and really impress upon our residents how important it is for them to also practice personal responsibility, we can effectively recover and turn the tide. I, like everybody else, would love to get back to something that more resembles what life looked like before this pandemic. Unfortunately, that is not an option for us right now. What is imperative for us right now is to hold the line and to practice good safety, to practice the protocol, because the extent to which we do that will get us back to having our economy reengaged, will get us back to being able to more, better physically and socially engage. It will open up our places of worship, but we've got to do our part right now to get this virus under control.
Absolutely. And as we try to incentivize people to engage in the positive engagements as it relates to saving their lives, the governor has put a mandate by executive order to wear your mask. And those that need assistance in getting masks, we have disposable masks. You can call the city of Flint at 410-2020, 410-2020, or go to the City of Flint website to order masks if you have a business or a house of worship that people are going to be congregating in. It is a mandate by law now, starting Monday. It will be a criminal act not to have a mask on. And also it will be a hefty fine of $500 if you're given a citation. And so what happens is that we have assumingly good-willed individuals that may not acquiesce to the will of government by saying that we need you to do these things to stop the spread of this virus. But what happens is that we have people that's going to say, I'm not going to wear a mask and I don't want to pay the money, and it's going to cause a level of confusion. But we want to make sure we make it very easy for you inside the jurisdictions of the city of Flint to wear the mask. We're going to provide them for you. And if you want a mask with a little more swag, you can call Fabrics of Faith. And I'm going to ask Pastor Hawkins to give that once again, because we definitely don't want to criminalize you as we try to save your life. And so that's why we need to be positive in our engagement. And that's why the state representative, Cynthia Neely, has engaged young people by saying, if you're in a graduating class, all you have to do is go to her state website page or her state Facebook page, post a picture of you with your mask with swag by masking up, and then you'll be entered into a contest. And so it will be first, second, and third place winners from each high school of the graduating class will be eligible to win a cash prize for displaying your mask with swag. And Pastor Hawkins, if they don't have the ability to design or to come across things much like myself, I don't have an artistic eye or the touch to be able to make this look good. But I think it makes me look a little bit better when I put it over my face. But I use Fabrics of Faith. And how can I get in contact with them to give me my mask with swag? Pastor Hawkins?
Yes, sir, Mayor. That number is 810-210-5045. Again, 810-210-5045.
Right. And I'm going to put another order in. I want masks with swag to display something great, and the messages of hope will be displayed on mine, and I will give that order out and I will put messages of hope on our mask because we will get through. And Dr. Reynolds, he's my guy. He's been the one who actually engaged this administration by telling us about the water reconnection that was so important to be able to preserve life. And the city of Flint started 2 weeks before the governor put an executive order out through the full state of Michigan. So we were already ahead of the curve by the leadership of Dr. Lawrence Reynolds providing us with that leadership. And so, Dr. Reynolds, are you going to get a mask with swag? Because I've seen a couple of your masks. And so, but I want to know what kind of mask you're going to get.
My wife is in charge of the swag department, so I have a bedrock mask now, besides some old folks patterns on several masks, and I have my backup paper masks. So, and I have those things you can pull over your neck and pull over your face. So I'm ready. I may not win the contest, but I'll outlast everybody I can.
All right, and I know Dr. Verholden has some Michigan State masks. One she gave to the state representative Cynthia Neely, and also one is for the governor Gretchen Whitmer. We have not been able to get to the governor just yet because we have all been running around working hard. But what kind of mask or swag do you have, Dr. Verholden?
So I done swagged up my whole family. I found a nice mask maker, and I got a great one for my son that has a picture of the notorious B.I.G. with his hand up in the air. For my son, we've done a whole lot of making masks ourselves. So, and now I see the mask as an accessory. So I will color coordinate my mask with my outfit. So I'm with it. I'm bringing the swag to the whole Mask Up campaign. This is one of those things where we didn't ask for this, but now it's here. We might as well include it. So now my mask is just a built-in accessory, and I color coordinate them with my outfit.
Okay, so we're gonna launch that, and it was the intellectual property of us as a group, Mask with Swag, and we're gonna start promoting that so people can get on board and present that, and we're gonna try to incentivize the Mask with Swag element. So start posting your pictures, Mask with Swag. You can go to my personal Facebook page, Sheldon Neely, or even the City of Flint's Facebook page, and post your mask with swag, and let's start seeing who has the best mask with the best swag from all generations. As Dr. Reynolds said, he has the patterns for the old people. I don't know what that is, but I'm gonna try to stay away from them because I want to stay young as long as I can. Okay, and also Fabrics of Faith for your designing of your mask with swag. 210-5045 210-5045. And if you need disposable masks, if you need help from the City of Flint, we will provide you masks. We want to thank State Representative Cynthia Neely for her leadership with the Mask Up campaign, being proactive in her thinking as it relates to trying to preserve lives in our community. It is so very important. One of the first confirmed cases inside of Genesee County was Mrs. Sharon Riley, a great friend, much like a mother to me. I've been knowing her my whole life. One of my mother's best friends. She was one of the first confirmed cases inside of Genesee County. Her life changed. She spent 3 months in the hospital, and she returned to life very differently. Her husband passed away of COVID-19, and also her brother. I love Mrs. Riley, just like if she was my mother. We presented her with a key to the City of Flint for her courageous, effort to making it through with faith, strength, and the love of all the people around her to get through the COVID virus. But life has changed for her, and she will tell you that this thing is real. It is very real. So when we see these gatherings and these parties, and we don't want to take anything away from you, but we don't want this COVID-19 virus to take life away from you. And so be very patient and gravitate toward the positive. And so get masked with swag, put positive message, affirmations of hope, affirmations of us coming together and living together. And so I'll give each one of my listeners on the Facebook Burst program, my panel here, opportunity to speak here at the end. That go ahead and talk about gravitating toward the positive. And I'll start with you, Pastor Hawkins. Pastor Hawkins, you there? He might be trying to find his mute button. So that means I'll just pass him by and go to Dr.
Right.
Oh,
I apologize for that. Trying to find my mute button, as you stated.
okay.
But again, as you stated, positive message of hope. I encourage everybody. I know that I think Dr. Verhoeven said it best. You know, we didn't ask for this. If we had it our way, we wouldn't have it. But because it's a part of our life, we'll do our very best to make the best of it. Not only with masking up, but just encouraging each other. You know, it's often hard to see a smile with the mask on. I make it my business to speak to people when I pass them, so that at least they know that I'm being very courtesy with them, and just to be a sign of encouragement. So I would ask that we just continue to stay positive, stay focused, and as we deal with this, do our very best to not only to stay that way, but to help someone else be that way as well. And so I just encourage that. And I also encourage again for the churches to really be mindful of science. And as much as we would all love to get back to that form of worship that we once knew, just now is not the time. But there's so many ways we can reach out to people, whether we're calling them, whether we're texting, Facebook, inbox, and really just do our very best to keep people encouraged without, and at the same time, keeping them encouraged, but keeping them safe. Thank you, Mayor.
You're welcome. And Dr. Verhoeven, Mass with Swag and positive messaging.
So Mass with Swag, one of the things that immediately came to mind is, like I said, I got this really cool mask that I hope my son loves. You can also be a support and a source of encouragement for others, especially people who are struggling during this season. So you might be in a position to get a Mask with Swag for somebody else. What a great unsolicited gift to give somebody in this season. So I really encourage people. I know it feels like things are kind of spinning out of control and we don't have a lot of say on what's happening. But the things that you can control are your generosity of spirit, your generosity of time. You can be very generous with the sort of messages that you give to others. And you can be very generous by protecting yourself and protecting others. And I also do want to encourage people. One of my favorite speeches of all time is a speech by Reverend Jesse Jackson Sr., and it's his David and Goliath speech that he gave during his first run for president. And he talks about David, this young, small creature who fought the mighty Goliath with nothing but a rock and a slingshot. And he tells us all to pick up our rocks. And our rocks in this season are our votes. So if you are not registered to vote, please go register to vote. If you are registered, be a source of encouragement for others to get registered and make sure that you complete the census. We are going to need the resources that come for the census now more than ever. You said it, we've been hit economically hard by this pandemic. And the only way for us to make sure we get our fair share of health is for us to be known and to be counted. So be a blessing to others. Keep your generosity of spirit and safety and protection. Register to vote and support others in registering, and do your census.
Absolutely. Census is very important. 10 minutes for 10 years of funding. We need you to be able to speak that as well. And that's going to be one of my Mask of Swag. You just gave me another idea, is the 2020 census count. Be a part of it. So I'll be talking to Fabrics of Faith about that. Dr. Reynolds, always the coolest, always the wise one, always very, very stoic in the way that you present things. And I want to thank you personally on behalf of the residents inside the city of Flint for your advocacy and your leadership in guiding us. And we will continue to do so with saving lives in a positive way. Dr. Reynolds.
Mr. Mayor, we are acting with the power of love, peace, and understanding, and we must remember to reflect before we react. Don't let the circumstances control your life. Rise above them, transcend above them, and struggle when you must.
Right, and I tell you, I think the other Dr. Reynolds must have wrote that for you, your wife. That was very soul trainish, and I loved every minute of what you just said. That was very Don Cornelius, and thank her for writing that for you. So with that said,
Well, Mayor Neely, we already know behind every great man, there's a great woman.
absolutely.
And you shout out our wonderful representative and your mom every time. So bravo to all the great women underneath and behind and beside and in front of these great men.
Absolutely. You know, President Obama said when women succeed, America succeeds. And we know in the African American community, women have been the load-bearing wall in our society as they continue to do so. As men are stepping up to the plate to be able to try to lead, we must do so in a positive way and provide an example for our younger men. We have to be able to provide that example as Dr. Reynolds has been performing and perfecting the example for me, even in my leadership role on the medical side. He has been doing a great job there. And also my brother, Pastor Jeffrey Hawkins, who has been also a great mentor, walking alongside of me for at least a decade and a half. And so I appreciate that. And also, Dr. Furholden, you have lent your services to us, your expertise, and we appreciate that. But I know that's the Viking inside of you. And so with that, I love you, Mom. God bless. Be positive. Get a mask with swag. Remember, it's the law now. Do everything positive. Gravitate toward the positive. Rebuke all the negative. And God bless you guys. Thank you.